Question 1. A nurse is caring for a patient with severe hyponatremia, serum sodium 120 milliequivalent per liter. Which of the following interventions should the nurse question? A. Administering hypertonic saline solution. B. Restricting water intake. C. Administering isotonic saline. D. Administering diuretics as prescribed. Answer: D. Administering diuretics as prescribed. Rationale: diuretics can exacerbate hyponatremia by further lowering sodium levels. Hypertonic saline is used to correct severe hyponatremia. Question 2. A patient is receiving warfarin for atrial fibrillation. Which assessment finding requires immediate intervention? A. An INR of 3.0. B. A recent head injury. C. A positive stool guaiac test. D. An increase in dietary vitamin K intake. Answer: B. A recent head injury. Rationale: a recent head injury in a patient on warfarin increases the risk of intracranial bleeding. Immediate intervention is required. Question 3. Which action by the nurse is most appropriate when a patient who is receiving chemotherapy develops a fever? A. Withhold antibiotics until the physician confirms an infection. B. Perform blood cultures before administering antibiotics. C. Administer acetaminophen to reduce the fever. D. Immediately administer broad-spectrum antibiotics. Answer: B. Perform blood cultures before administering antibiotics. Rationale: blood cultures should be performed before administering antibiotics to identify the causative organism. Early antibiotic administration may obscure diagnostic results. Question 4. Which intervention should the nurse implement to reduce the risk of catheter-associated urinary tract infection (CAUTI) in a hospitalized patient? A. Ensure proper hand hygiene and aseptic technique during catheter insertion. B. Change the urinary catheter every 48 hours. C. Use an indwelling catheter for all patients requiring urinary monitoring. D. Administer antibiotics as a prophylactic measure to all catheterized patients. Answer: A. Ensure proper hand hygiene and aseptic technique during catheter insertion. Rationale: the best practice to prevent CAUTI is to use proper technique during catheter insertion and maintenance. The other options increase the risk of infection. Question 5. A patient is receiving hemodialysis and begins to experience hypotension, dizziness, and nausea during treatment. What is the nurse's first priority action? A. Administer a bolus of normal saline. B. Discontinue the hemodialysis session immediately. C. Slow the dialysis rate. D. Increase the dialysis flow rate to increase blood volume. Answer: C. Slow the dialysis rate. Rationale: slowing the dialysis rate is the first priority to allow the body to stabilize and prevent further complications such as shock or arrhythmias. Question 6. A nurse is caring for a patient who has a history of seizures. The patient is observed to be seizing. What is the nurse's immediate priority? A. Administering intravenous lorazepam as ordered. B. Ensuring the patient's airway is patent. C. Documenting the duration and characteristics of the seizure. D. Positioning the patient to prevent injury. Answer: B. Ensuring the patient's airway is patent. Rationale: ensuring a patent airway is the highest priority during a seizure to prevent hypoxia. Administration of lorazepam and positioning should follow once the airway is secured. Question 7. What is the most important nursing action to prevent medication errors in a pediatric patient? A. Administer the same dose as for adults, adjusting for weight. B. Verify the weight and age to calculate the correct dosage. C. Ask the parent about the correct dosage. D. Only administer medications that are in liquid form. Answer: B. Verify the weight and age to calculate the correct dosage. Rationale: correctly calculating the medication dosage based on the child's weight and age is the most important step. Administering adult doses or relying on parental knowledge can lead to errors. Question 8. A nurse is caring for a patient receiving IV fluids for dehydration. The patient develops crackles in the lungs and shortness of breath. What is the nurse's immediate priority action? A. Increase the IV fluid rate. B. Call the physician immediately. C. Decrease the IV fluid rate. D. Administer a diuretic as ordered. Answer: C. Decrease the IV fluid rate. Rationale: crackles and shortness of breath suggest fluid overload, so the nurse should decrease the IV rate to prevent further complications. Question 9. A patient with a history of chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy. The nurse observes that the oxygen saturation has dropped to 88%. What is the most appropriate action? A. Increase the oxygen flow rate. B. Reposition the patient to promote better breathing. C. Continue oxygen at the current rate. D. Administer a bronchodilator. Answer: B. Reposition the patient to promote better breathing. Rationale: repositioning can help open the airways and improve oxygenation. Increasing the oxygen flow rate without addressing the root cause of the drop in saturation is not the best approach. Question 10. A nurse is preparing to administer a high-alert medication. Which of the following safety protocols should the nurse follow? A. Double-check the medication dosage with the patient. B. Verify the medication with another nurse before administration. C. Administer the medication as quickly as possible to avoid delays. D. Skip the medication check if the medication is familiar. Answer: B. Verify the medication with another nurse before administration. Rationale: high-alert medications should always be verified with another nurse to prevent administration errors. Skipping checks increases the risk of medication errors. Question 11. A patient with diabetes is admitted with a blood glucose level of 45 milligrams per deciliter. What is the most appropriate intervention? A. Administer 25 units of insulin. B. Provide 15 grams of a fast-acting carbohydrate. C. Administer an oral hypoglycemic agent. D. Increase the patient's IV fluids. Answer: B. Provide 15 grams of a fast-acting carbohydrate. Rationale: the first intervention for hypoglycemia is to provide a fast-acting carbohydrate to raise the blood sugar level. Insulin and hypoglycemic agents would further lower the blood sugar. Question 12. A nurse is preparing to discharge a patient with a new prescription for anticoagulant therapy. Which teaching point is most important? A. Limit your intake of vitamin K-rich foods. B. Discontinue the medication if you feel dizzy. C. It is safe to take over-the-counter pain medications without checking. D. You can skip doses if you forget to take the medication. Answer: A. Limit your intake of vitamin K-rich foods. Rationale: vitamin K can interfere with the action of anticoagulants. It's crucial to maintain a consistent intake of vitamin K while on these medications. Question 13. Which action is most appropriate when caring for a patient with a compromised immune system to prevent infection? A. Use a regular surgical mask during care. B. Implement contact precautions for all patient interactions. C. Perform thorough hand hygiene and wear appropriate PPE. D. Restrict visitors only during known outbreaks. Answer: C. Perform thorough hand hygiene and wear appropriate PPE. Rationale: Proper hand hygiene and PPE are essential in preventing infection for immunocompromised patients, as they are more susceptible to infections. Question 14. What is the nurse's priority action when a patient is experiencing an anaphylactic reaction to a medication? A. Administer antihistamines as ordered. B. Call for emergency assistance and ensure an open airway. C. Monitor vital signs and wait for the reaction to subside. D. Start an intravenous line with normal saline. Answer. B. Call for emergency assistance and ensure an open airway. Rationale. The priority during an anaphylactic reaction is ensuring the patient's airway is open and calling for emergency help. Question 15. When managing a patient with acute kidney injury, AKI, which laboratory result requires immediate attention? A. Serum potassium level of 4.5 milliequivalent per liter. B. Serum creatinine increase from 1.2 milligrams per deciliter to 1.6 milligrams per deciliter. C. Blood urea nitrogen, BUN, of 10 milligrams per deciliter. D. Sodium level of 136 milliequivalent per liter. Answer. B. Serum creatinine increase from 1.2 milligrams per deciliter to 1.6 milligrams per deciliter. Rationale. A significant increase in serum creatinine suggests a worsening of kidney function, requiring immediate intervention. Question 16. Which strategy is most effective in reducing the risk of hospital-acquired pneumonia, HAP, in ventilated patients? A. Elevating the head of the bed to 30 to 45 degrees. B. Administering broad-spectrum antibiotics early. C. Sedating the patient to reduce respiratory effort. D. Repositioning the patient every 8 hours. Answer. A. Elevating the head of the bed to 30 to 45 degrees. Rationale. Elevating the head of the bed reduces the risk of aspiration and helps prevent hospital-acquired pneumonia in ventilated patients. Question 17. A nurse is preparing to administer a blood transfusion. What is the first action the nurse should take before beginning the transfusion? A. Verify the blood product with another nurse. B. Obtain the patient's consent. C. Begin the transfusion immediately to avoid delay. D. Check the patient's temperature for signs of fever. Answer. A. Verify the blood product with another nurse. Rationale. Double-checking the blood product with another nurse is the critical first step to ensure the correct transfusion. Question 18. When should a nurse begin discharge planning for a patient admitted with a stroke? A. At the time of admission. B. When the patient's condition stabilizes. C. When the patient is transferred to rehabilitation. D. After the patient has been discharged from the hospital. Answer. A. At the time of admission. Rationale. Discharge planning should begin immediately upon admission to ensure a smooth transition and that the patient's needs are met. Question 19. Which of the following is the most effective way to prevent ventilator-associated pneumonia, VAP? A. Sedate the patient to reduce agitation. B. Perform oral care using chlorhexidine. C. Administer systemic antibiotics prophylactically. D. Place the patient on a high-protein diet. Answer. B. Perform oral care using chlorhexidine. Rationale. Regular oral care with chlorhexidine reduces the risk of ventilator-associated pneumonia by preventing bacterial colonization. Question 20. A nurse is caring for a patient with a pressure ulcer. Which action is most important to prevent further breakdown? A. Apply a thick layer of lotion to the skin. B. Reposition the patient at least every 2 hours. C. Keep the patient's bed flat at all times. D. Increase the patient's fluid intake. Answer. B. Reposition the patient at least every 2 hours. Rationale: repositioning the patient regularly is the most effective intervention to prevent further breakdown of pressure ulcers. Question 21. A nurse is caring for a patient with acute pancreatitis. The patient is complaining of severe abdominal pain. Which intervention should the nurse prioritize? A. Administer pain medication as prescribed. B. Provide oral fluids to rehydrate the patient. C. Assist the patient in a fetal position to alleviate pain. D. Place the patient in a low Fowler's position. Answer: A. Administer pain medication as prescribed. Rationale: managing pain is the priority for comfort and stabilization of the patient. Oral fluids are contraindicated in acute pancreatitis. Question 22. A 72-year-old patient is admitted with a diagnosis of congestive heart failure, CHF, and reports feeling short of breath. What should the nurse do first? A. Administer the prescribed diuretics. B. Place the patient in high Fowler's position. C. Perform a physical assessment and auscultate lung sounds. D. Notify the physician immediately. Answer: C. Perform a physical assessment and auscultate lung sounds. Rationale: a thorough assessment is necessary to understand the severity of the symptoms and guide further interventions. Question 23. A patient is receiving IV insulin to manage hyperglycemia. Which lab result requires immediate attention? A. Potassium level of 5.0 milliequivalent per liter. B. Glucose level of 150 milligrams per deciliter. C. Sodium level of 130 milliequivalent per liter. D. pH of 7.28, mild acidosis. Answer: D. pH of 7.28, mild acidosis. Rationale: a pH of 7.28 indicates metabolic acidosis, a potential complication of insulin therapy, especially in patients with diabetic ketoacidosis, DKA. Question 24. A nurse is caring for a patient who is receiving a blood transfusion. The nurse notices that the patient is experiencing chills, fever, and back pain. What is the nurse's priority action? A. Stop the transfusion immediately. B. Administer acetaminophen as prescribed. C. Notify the physician. D. Monitor the patient for further symptoms. Answer: A. Stop the transfusion immediately. Rationale: chills, fever, and back pain are signs of a hemolytic reaction. The first action is to stop the transfusion to prevent further harm. Question 25. A nurse is caring for a patient in the emergency department who is suspected of having a stroke. Which diagnostic test is most critical to perform first? A. CT scan of the head without contrast. B. MRI of the brain. C. Electrocardiogram ECG. D. Arterial blood gas ABG analysis. Answer: A. CT scan of the head without contrast. Rationale: a non-contrast CT scan is the most critical initial diagnostic test to differentiate between ischemic and hemorrhagic stroke. Question 26. A nurse is preparing to administer an intravenous medication to a patient with a central venous catheter, CVC. What is the nurse's priority action? A. Flush the CVC with saline before and after the medication. B. Ensure the medication is compatible with the CVC. C. Use a 20-gauge needle for injection. D. Administer the medication slowly to avoid side effects. Answer: A. Flush the CVC with saline before and after the medication. Rationale: flushing the CVC before and after the medication prevents occlusions and ensures proper medication administration. Question 27. A nurse is caring for a patient who has just undergone an abdominal surgery. The patient's urinary output has decreased to 20 milliliters per hour for the past 2 hours. What is the nurse's priority action? A. Increase the IV fluid rate. B. Check the urine catheter for kinks or obstruction. C. Notify the physician immediately. D. Administer a diuretic as prescribed. Answer: B. Check the urine catheter for kinks or obstruction. Rationale: the first step in managing decreased urine output is to check for a mechanical obstruction before initiating other interventions. Question 28. A nurse is caring for a patient with a history of deep vein thrombosis, DVT. The patient is complaining of sudden chest pain and difficulty breathing. What is the nurse's priority action? A. Administer oxygen therapy. B. Assess vital signs and oxygen saturation. C. Call for immediate assistance and prepare for possible cardiopulmonary resuscitation (CPR). D. Place the patient in a low Fowler's position. Answer: C. Call for immediate assistance and prepare for possible cardiopulmonary resuscitation (CPR). Rationale: sudden chest pain and difficulty breathing may indicate a pulmonary embolism, which requires immediate intervention. Question 29. A nurse is teaching a patient with diabetes about insulin administration. What is the most important teaching point regarding insulin injection sites? A. Rotate the injection sites to prevent lipodystrophy. B. Inject insulin into the abdomen for faster absorption. C. Use the thigh for the first injection and the abdomen for the second. D. Inject insulin only into the arms to reduce discomfort. Answer: A. Rotate the injection sites to prevent lipodystrophy. Rationale: rotating injection sites helps to prevent lipodystrophy and promotes consistent absorption of insulin. Question 30. A nurse is caring for a patient who is post-operative following a total hip replacement. The patient is at high risk for deep vein thrombosis, DVT. What intervention is most effective in preventing DVT in this patient? A. Administer anticoagulant medication as prescribed. B. Apply heat packs to the legs to reduce swelling. C. Encourage the patient to remain in bed and rest. D. Perform passive range of motion, ROM, exercises for the legs. Answer: A. Administer anticoagulant medication as prescribed. Rationale: anticoagulant medication is the most effective way to prevent DVT in post-operative patients. Question 31. A nurse is preparing to administer a dose of intravenous morphine to a post-operative patient. The patient has a respiratory rate of 8 breaths per minute. What is the nurse's priority action? A. Administer the morphine as prescribed. B. Withhold the morphine and notify the physician. C. Administer naloxone to reverse the effects of the morphine. D. Increase the oxygen flow rate to 6 liters per minute. Answer: B. Withhold the morphine and notify the physician. Rationale: a respiratory rate of 8 breaths per minute is concerning and may indicate respiratory depression from opioids. The morphine should be withheld. Question 32. A nurse is caring for a patient who is newly diagnosed with Parkinson's disease. Which of the following interventions is most important for managing the patient's condition? A. Encourage regular physical activity and exercise. B. Limit fluid intake to prevent overhydration. C. Implement a low-protein diet to enhance medication absorption. D. Avoid stimulating activities to prevent agitation. Answer: A. Encourage regular physical activity and exercise. Rationale: physical activity and exercise are essential for managing Parkinson's disease and improving mobility and quality of life. Question 33. A nurse is caring for a patient who has a chest tube for a pneumothorax. The patient's chest tube drainage system becomes disconnected. What is the nurse's immediate priority action? A. Clamp the chest tube. B. Place the chest tube end in a sterile saline solution. C. Secure the chest tube to prevent further air leakage. D. Call the physician immediately. Answer: B. Place the chest tube end in a sterile saline solution. Rationale: if the chest tube becomes disconnected, the nurse should place the end in sterile saline to prevent air from entering the pleural space. Question 34. A nurse is caring for a patient with a history of alcohol abuse. The patient is exhibiting signs of confusion, agitation, and tremors. What is the nurse's priority action? A. Administer a benzodiazepine as ordered. B. Restrict the patient's movement to prevent injury. C. Offer the patient food to help stabilize blood sugar. D. Notify the physician of the changes in mental status. Answer: A. Administer a benzodiazepine as ordered. Rationale: the patient may be experiencing alcohol withdrawal, and benzodiazepines are the treatment of choice to prevent seizures and delirium tremens. Question 35. A patient is being discharged with a prescription for oral anticoagulation therapy. What is the nurse's most important teaching point? A. Avoid foods high in vitamin K. B. Monitor for signs of bleeding, such as bruising and gums bleeding. C. Take the medication only when you feel lightheaded. D. Take the medication with food to prevent stomach upset. Answer: B. Monitor for signs of bleeding, such as bruising and gums bleeding. Rationale: patients on anticoagulants must be educated on recognizing signs of bleeding, a major complication of therapy. Question 36. A nurse is assessing a patient with end-stage renal disease who is on peritoneal dialysis. The patient is complaining of abdominal pain and distension. What is the most likely cause of these symptoms? A. Peritonitis. B. Fluid overload. C. Dialysis, catheter malfunction. D. Hyperkalemia. Answer: A. Peritonitis. Rationale: abdominal pain and distension are common symptoms of peritonitis, a potential complication of peritoneal dialysis. Question 37. A patient with severe asthma exacerbation is being administered a nebulized bronchodilator. What should the nurse monitor closely during the treatment? A. Blood pressure and heart rate. B. Respiratory rate and oxygen saturation. C. Urine output. D. Blood glucose levels. Answer: B. Respiratory rate and oxygen saturation. Rationale: during a bronchodilator treatment, the nurse should monitor the patient's respiratory status and oxygenation to evaluate the effectiveness of the medication. Question 38. A nurse is caring for a patient who has just been prescribed a new antihypertensive medication. What is the most important monitoring parameter for this patient? A. Blood pressure. B. Blood glucose levels. C. Respiratory rate. D. Liver function tests. Answer: A. Blood pressure. Rationale: the most important parameter to monitor in a patient taking antihypertensive medication is blood pressure to ensure the medication is effectively lowering it. Question 39. A patient is admitted with a diagnosis of acute respiratory distress syndrome, ARDS. What is the primary treatment goal for this patient? A. To improve oxygenation and ventilation. B. To prevent pulmonary embolism. C. To reduce cardiac workload. D. To manage fluid balance. Answer: A. To improve oxygenation and ventilation. Rationale: the primary treatment goal in ARDS is to optimize oxygenation and ventilation through mechanical ventilation and other interventions. Question 40. A nurse is caring for a patient who is receiving chemotherapy and is at high risk for infection. Which of the following actions should the nurse take to reduce the risk of infection? A. Place the patient in a private room. B. Administer prophylactic antibiotics. C. Limit the patient's fluid intake to reduce swelling. D. Avoid blood transfusions unless absolutely necessary. Answer: A. Place the patient in a private room. Rationale: placing the patient in a private room reduces exposure to potential infectious agents, especially for immunocompromised patients. Question 41. A nurse is caring for a patient who has just undergone a coronary artery bypass graft (CAB) surgery. The patient reports chest pain, and the nurse observes decreased urine output. What is the most likely cause of these symptoms? A. Cardiac tamponade. B. Acute renal failure. C. Fluid overload. D. Myocardial ischemia. Answer: A cardiac tamponade. Rationale: cardiac tamponade can cause chest pain, decreased urine output, and hypotension due to the accumulation of fluid around the heart. Question 42. A nurse is caring for a patient with a new diagnosis of hyperthyroidism. The patient is reporting weight loss, increased appetite, and palpitations. What is the most appropriate intervention? A. Administer an antithyroid medication. B. Educate the patient about weight gain strategies. C. Monitor the patient's blood pressure regularly. D. Restrict the patient's fluid intake. Answer: A. Administer an antithyroid medication. Rationale: the primary treatment for hyperthyroidism includes antithyroid medications to reduce thyroid hormone production. Question 43. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is on home oxygen therapy. The patient's oxygen saturation is 88% on room air. What should the nurse do first? A. Administer supplemental oxygen as prescribed. B. Assess the patient's respiratory rate and effort. C. Increase the oxygen flow rate. D. Notify the physician immediately. Answer: B. Assess the patient's respiratory rate and effort. Rationale: the nurse should first assess the patient's respiratory status to determine the cause of low oxygen saturation before initiating further interventions. Question 44. A nurse is caring for a patient who is receiving intravenous fluids. The patient's serum sodium level is 132 milliequivalent per liter. What is the nurse's priority action? A. Administer hypertonic saline as ordered. B. Increase the IV fluid rate to correct dehydration. C. Monitor the patient's neurologic status closely. D. Notify the physician for a medication adjustment. Answer: C. Monitor the patient's neurologic status closely. Rationale: sodium levels below 135 milliequivalent per liter can cause neurologic symptoms such as confusion or seizures, requiring close monitoring of the patient's condition. Question 45. A nurse is caring for a patient with a recent diagnosis of peptic ulcer disease, PUD. The patient reports new, sharp abdominal pain and vomits blood. What is the nurse's priority intervention? A. Administer pain medication as prescribed. B. Obtain a complete blood count (CBC). C. Place the patient on NPO status and notify the physician. D. Administer an antiemetic as ordered. Answer: C. Place the patient on NPO status and notify the physician. Rationale: the presence of vomiting blood indicates possible gastrointestinal bleeding. The patient should be placed on NPO status to prevent further irritation, and the physician should be notified. Question 46. A nurse is caring for a patient who is post-operative following a laparotomy. The patient has not passed gas or had a bowel movement in 48 hours. What is the most appropriate intervention? A. Administer a laxative as ordered. B. Encourage the patient to increase oral intake. C. Perform abdominal palpation for distension. D. Notify the physician for a possible bowel obstruction. Answer: C. Perform abdominal palpation for distension. Rationale: abdominal distension could indicate a complication such as a bowel obstruction. The nurse should first assess the abdomen for signs of this complication. Question 47. A nurse is caring for a patient who is receiving warfarin. The patient's international normalized ratio, INR, is 5.2. What is the nurse's priority action? A. Administer vitamin K as prescribed. B. Withhold the warfarin and monitor for signs of bleeding. C. Notify the physician and prepare for a blood transfusion. D. Continue the warfarin and monitor the INR again in 24 hours. Answer: B. Withhold the warfarin and monitor for signs of bleeding. Rationale: an INR of 5.2 is above the therapeutic range, increasing the risk of bleeding. The warfarin should be withheld, and the patient should be monitored for signs of bleeding. Question 48. A nurse is caring for a patient with severe burns covering 30% of their body. What is the most important intervention in the first 24 hours? A. Administer a tetanus shot as ordered. B. Initiate fluid resuscitation to prevent hypovolemic shock. C. Apply topical antibiotics to the burns. D. Administer pain medications regularly. Answer: B. Initiate fluid resuscitation to prevent hypovolemic shock. Rationale: fluid resuscitation is the priority in the first 24 hours for patients with severe burns to prevent hypovolemic shock. Question 49. A nurse is assessing a patient with diabetic ketoacidosis, DKA. The patient's blood glucose is 500 milligrams per deciliter, and their pH is 7.2. What is the nurse's first priority? A. Administer a bolus of normal saline. B. Administer an insulin infusion as ordered. C. Administer potassium supplementation. D. Monitor the patient's vital signs closely. Answer: B. Administer an insulin infusion as ordered. Rationale: insulin is the primary treatment to reduce the blood glucose and correct the metabolic acidosis in DKA. Question 50. A nurse is caring for a patient who has been diagnosed with sepsis. Which of the following interventions is most critical in the first hour? A. Administer broad-spectrum antibiotics. B. Obtain a complete blood count, CBC, and blood cultures. C. Administer a bolus of normal saline. D. Perform a thorough respiratory assessment. Answer: C. Administer a bolus of normal saline. Rationale: early fluid resuscitation with normal saline is critical to improving perfusion and preventing organ failure in sepsis. Question 51. A nurse is caring for a patient who is receiving total parenteral nutrition, TPN. What is the nurse's priority action if the TPN solution runs out before the next bag is available? A. Administer 10% dextrose solution until the new TPN bag is available. B. Administer normal saline to maintain hydration. C. Stop the TPN infusion and monitor the patient's blood glucose. D. Notify the physician immediately. Answer: A. Administer 10% dextrose solution until the new TPN bag is available. Rationale: to prevent hypoglycemia, a 10% dextrose solution should be given until the new TPN bag is available. Question 52. A nurse is caring for a patient with acute respiratory distress syndrome, ERDS. What is the most effective ventilator setting for managing this patient's condition? A. High tidal volumes and low respiratory rates. B. Low tidal volumes and high respiratory rates. C. High positive end expiratory pressure, PEEP, and low tidal volumes. D. Low positive end expiratory pressure, PEEP, and high tidal volumes. Answer: C. High positive end expiratory pressure, PEEP, and low tidal volumes. Rationale: high PEEP and low tidal volumes are used in ARDS to improve oxygenation while preventing barotrauma. Question 53. A nurse is caring for a patient who has just undergone a lumbar puncture. What is the most important nursing intervention following the procedure? A. Position the patient flat for several hours. B. Encourage the patient to drink caffeinated beverages. C. Administer pain medication as prescribed. D. Monitor for signs of headache or leakage of cerebrospinal fluid, CSF. Answer: A. Position the patient flat for several hours. Rationale: positioning the patient flat after a lumbar puncture helps reduce the risk of headache due to CSF leakage. Question 54. A nurse is caring for a patient who is post-operative following a thyroidectomy. The patient reports a tingling sensation around the mouth and fingers. What is the nurse's priority action? A. Administer calcium supplements. B. Monitor the patient's blood pressure. C. Assess for signs of bleeding around the surgical site. D. Administer a pain reliever as prescribed. Answer: A. Administer calcium supplements. Rationale: tingling around the mouth and fingers can indicate hypocalcemia, a potential complication of thyroidectomy due to damage to the parathyroid glands. Question 55. A nurse is assessing a patient with acute pancreatitis. The patient's serum amylase level is elevated, and they are complaining of severe abdominal pain. What is the nurse's priority action? A. Administer prescribed pain medications. B. Place the patient in a low Fowler's position. C. Provide the patient with clear fluids to relieve nausea. D. Notify the physician of the elevated amylase level. Answer: A. Administer prescribed pain medications. Rationale: pain management is the priority in acute pancreatitis to provide relief and prevent further complications. Question 56. A nurse is caring for a patient who is receiving chemotherapy and has developed mucositis. What is the best nursing intervention to alleviate the patient's discomfort? A. Encourage the patient to eat spicy foods to stimulate salivation. B. Offer bland, soft foods and warm saltwater rinses. C. Administer an opioid analgesic as prescribed. D. Apply ice packs to the patient's mouth. Answer: B. Offer bland, soft foods and warm saltwater rinses. Rationale: bland foods and warm saltwater rinses help soothe the mucosa and prevent further irritation. Question 57. A nurse is caring for a patient with a chest tube. The nurse notes that the water seal chamber is bubbling continuously. What is the nurse's priority action? A. Check the chest tube for an air leak. B. Assess the patient for signs of respiratory distress. C. Increase the suction setting on the chest tube. D. Notify the physician immediately. Answer: A. Check the chest tube for an air leak. Rationale: continuous bubbling in the water seal chamber can indicate an air leak, which should be addressed immediately to prevent complications. Question 58. A nurse is caring for a patient with chronic liver disease who develops confusion and agitation. What is the nurse's priority action? A. Administer an intravenous sedative as ordered. B. Assess the patient for signs of hepatic encephalopathy. C. Place the patient on NPO status and monitor vital signs. D. Perform a full neurological assessment and notify the physician. Answer: B. Assess the patient for signs of hepatic encephalopathy. Rationale: confusion and agitation are common signs of hepatic encephalopathy, which can be managed with lactulose and other treatments. Question 59. A nurse is caring for a patient who is suspected of having a myocardial infarction, MI. Which diagnostic test is most important to confirm the diagnosis? A. Troponin level. B. Electrocardiogram, ECG. C. Chest X-ray. D. Complete blood count, CBC. Answer: B. Electrocardiogram, ECG. Rationale: an ECG is the most important initial diagnostic test to confirm a myocardial infarction by identifying characteristic changes in the heart's electrical activity. Question 60. A nurse is caring for a patient with a history of asthma. The patient reports a sudden worsening of shortness of breath and wheezing. What is the nurse's first action? A. Administer a bronchodilator. B. Administer oxygen via nasal cannula. C. Perform a peak flow measurement. D. Assess for triggers of the asthma attack. Answer: A. Administer a bronchodilator. Rationale: administering a bronchodilator is the first action to relieve acute bronchospasm in asthma and improve the patient's breathing. Question 61. A nurse is caring for a patient with acute glomerulonephritis. The nurse notes that the patient is hypertensive and has edema in the legs and face. What is the priority intervention? A. Administer diuretics as prescribed. B. Restrict sodium intake and monitor fluid balance. C. Provide corticosteroids as prescribed. D. Encourage ambulation to reduce edema. Answer: B. Restrict sodium intake and monitor fluid balance. Rationale: restricting sodium intake and monitoring fluid balance are key to managing hypertension and edema in glomerulonephritis. Question 62. A nurse is caring for a patient with a peripherally inserted central catheter, PICC. What is the most important intervention to prevent complications? A. Ensure the catheter is placed in the patient's dominant arm. B. Flush the catheter with saline every 12 hours. C. Verify placement with an X-ray before use. D. Use the PICC for all types of medication administration. Answer: C. Verify placement with an X-ray before use. Rationale: the catheter should be confirmed as correctly placed via an X-ray to ensure safety before starting any infusions. Question 63. A nurse is assessing a patient who has been prescribed warfarin therapy. Which finding requires immediate intervention? A. The patient has an INR of 2.5. B. The patient has ecchymosis and petechiae. C. The patient's diet is rich in vitamin K. D. The patient has a blood pressure of 120/80. Answer: B. The patient has ecchymosis and petechiae. Rationale: ecchymosis and petechiae may indicate bleeding, which is a sign of potential complications with warfarin therapy. Question 64. A nurse is caring for a patient with acute pancreatitis who has developed jaundice. What is the nurse's priority intervention? A. Administer pain medications as prescribed. B. Monitor the patient's bile duct for obstruction. C. Administer antiemetic medication. D. Encourage the patient to eat small, frequent meals. Answer: B. Monitor the patient's bile duct for obstruction. Rationale: jaundice in acute pancreatitis can indicate a blocked bile duct, which requires immediate intervention to prevent further complications. Question 65. A patient with chronic kidney disease is receiving peritoneal dialysis. The nurse observes cloudy dialysate. What is the priority action? A. Notify the physician and document the findings. B. Administer an antibiotic as prescribed. C. Check the patient's blood pressure. D. Monitor the patient's temperature. Answer: A. Notify the physician and document the findings. Rationale: cloudy dialysate could indicate peritonitis, a serious complication requiring immediate notification of the healthcare provider. Question 66. A nurse is caring for a patient with a central venous catheter, CVC. The nurse observes that the CVC dressing is saturated with blood. What is the nurse's immediate priority action? A. Reinforce the dressing with a sterile bandage. B. Check the catheter site for signs of infection. C. Remove the CVC and apply pressure to the site. D. Notify the physician immediately. Answer: D. Notify the physician immediately. Rationale: saturation of the dressing with blood may indicate a catheter-related complication or hemorrhage, requiring immediate intervention. Question 67. A nurse is assessing a patient who is post-operative following a thyroidectomy. The patient exhibits hoarseness and difficulty swallowing. What is the nurse's priority action? A. Assess for signs of hypocalcemia. B. Notify the physician of possible vocal cord damage. C. Administer a pain reliever as prescribed. D. Monitor the patient's blood pressure. Answer: B. Notify the physician of possible vocal cord damage. Rationale: hoarseness and difficulty swallowing can indicate damage to the vocal cords or recurrent laryngeal nerve, which requires prompt medical attention. Question 68. A nurse is caring for a patient who has just received a kidney transplant. What is the most important post-operative intervention to prevent rejection? A. Administer corticosteroids as prescribed. B. Encourage the patient to increase fluid intake. C. Monitor the patient's electrolyte levels. D. Provide education on maintaining a low-protein diet. Answer: A. Administer corticosteroids as prescribed. Rationale: corticosteroids are essential in preventing organ rejection following a kidney transplant. Question 69. A nurse is caring for a patient with deep vein thrombosis, DVT, who is on heparin therapy. The nurse observes that the patient is experiencing bruising and bleeding from the gums. What is the nurse's priority action? A. Apply pressure to the bleeding sites. B. Administer vitamin K as prescribed. C. Notify the physician immediately. D. Withhold the heparin and monitor the patient's condition. Answer: C. Notify the physician immediately. Rationale: bleeding while on heparin therapy is a serious concern, and immediate notification of the physician is necessary to adjust treatment. Question 70. A nurse is caring for a patient who has developed a pressure ulcer on the sacrum. What is the best intervention to promote healing? A. Apply an occlusive dressing to the wound. B. Keep the patient's skin dry and clean. C. Perform daily wound debridement. D. Apply a wet-to-dry dressing. Answer: B. Keep the patient's skin dry and clean. Rationale: maintaining a clean and dry environment is crucial to preventing further breakdown and promoting healing of pressure ulcers. Question 71. A nurse is caring for a patient with a history of alcohol abuse who is receiving benzodiazepines for withdrawal symptoms. The patient starts to exhibit confusion, agitation, and increased tremors. What is the nurse's priority action? A. Increase the dose of the benzodiazepine. B. Administer naloxone to reverse the effects. C. Notify the physician immediately. D. Monitor the patient for signs of seizure activity. Answer: C. Notify the physician immediately. Rationale: the patient's symptoms may indicate worsening withdrawal or another complication requiring immediate medical evaluation. Question 72. A nurse is caring for a patient with a ventilator-associated pneumonia, VAP, who is receiving broad-spectrum antibiotics. What is the priority action to ensure effective antibiotic therapy? A. Perform a sputum culture to identify the pathogen. B. Increase the dose of the antibiotics. C. Change the ventilator tubing every 24 hours. D. Administer intravenous fluids to improve circulation. Answer: A. Perform a sputum culture to identify the pathogen. Rationale: identifying the pathogen through sputum culture is essential for tailoring antibiotic therapy and ensuring effectiveness. Question 73. A nurse is caring for a patient who has a history of epilepsy and is now experiencing status epilepticus. What is the nurse's first priority action? A. Administer intravenous lorazepam as prescribed. B. Perform a full neurological assessment. C. Document the onset and duration of the seizure. D. Ensure the patient's airway is clear. Answer: D. Ensure the patient's airway is clear. Rationale: maintaining a patent airway is the first priority in a patient experiencing status epilepticus to prevent hypoxia and brain damage. Question 74. A nurse is caring for a patient with systemic lupus erythematosus, SLE, who is experiencing a flare-up. What is the most important intervention to manage the patient's symptoms? A. Administer immunosuppressive agents as prescribed. B. Encourage increased physical activity. C. Provide an increased intake of protein and vitamins. D. Educate the patient on stress reduction techniques. Answer: A. Administer immunosuppressive agents as prescribed. Rationale: immunosuppressive agents are used to control the autoimmune response and manage SLE flare-ups. Question 75. A nurse is caring for a post-operative patient who has developed a hematoma at the surgical site. The patient is experiencing increasing pain and swelling. What is the nurse's immediate action? A. Apply ice to the surgical site. B. Monitor vital signs and notify the physician. C. Administer pain medication as prescribed. D. Elevate the surgical site to reduce swelling. Answer: B. Monitor vital signs and notify the physician. Rationale: a hematoma can lead to complications such as bleeding or infection, requiring prompt medical evaluation and intervention. Question 76. A nurse is caring for a patient who has a severe allergic reaction after receiving an injection. The patient's blood pressure drops, and they develop stridor. What is the nurse's first priority action? A. Administer epinephrine as prescribed. B. Perform a full respiratory assessment. C. Administer antihistamines as prescribed. D. Place the patient in a semi-Fowler's position. Answer: A. Administer epinephrine as prescribed. Rationale: epinephrine is the first-line treatment for severe allergic reactions and anaphylaxis, including symptoms of stridor and hypotension. Question 77. A nurse is caring for a patient with a history of hypertension who presents with a hypertensive crisis. What is the nurse's priority intervention? A. Administer the prescribed antihypertensive medication. B. Monitor vital signs closely and notify the physician. C. Provide an oxygen mask for the patient. D. Place the patient in a supine position to promote circulation. Answer: B. Monitor vital signs closely and notify the physician. Rationale: in a hypertensive crisis, monitoring vital signs and notifying the physician is critical to managing potential complications. Question 78. A nurse is caring for a patient who has recently been diagnosed with Parkinson's disease. What is the most important intervention to manage the patient's symptoms? A. Administer levodopa as prescribed. B. Encourage the patient to engage in social activities. C. Provide physical therapy to improve mobility. D. Educate the patient on the importance of rest. Answer: A. Administer levodopa as prescribed. Rationale: Levodopa is the primary medication for managing symptoms of Parkinson's disease by increasing dopamine levels in the brain.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.